44. Pain management. Which of the following statements made by a patient reflects that the patient understands the relationship between the gate control theory of pain and the use of meditation to relieve pain? A. Meditation controls pain by blocking pain impulses from coming through the gate. B. Meditation will help me sleep through the pain because it opens the gate. C. Meditation stops the occurrence of pain stimuli. D. Meditation alters the chemical composition of pain neuroregulators, which closes the gate. Answer A. Meditation controls pain by blocking pain impulses from coming through the gate. The gate theory states that pain impulses cause pain when they get through gates that are open. Pain is blocked when the gates are closed. Non-pharmacologic pain relief measures, such as meditation, work by closing the gates, which keeps pain impulses from coming through. Meditation does not open pain gates or stop pain from occurring. Meditation also does not have an effect on pain neuroregulators. A nursing student is planning care for an elderly patient who is experiencing pain. Which of the following statements made by the nursing student indicates the need for the nursing professor to clarify the nursing student's knowledge? A. Older patients often have difficulty determining what is causing their pain. B. It is safe to administer opioids to older adults as long as you start with small doses and frequently assess the patient's response to the medication. C. As adults age, their ability to perceive pain decreases. D. Patients who have dementia probably experience pain, and their pain is not always well controlled. Answer B. It is safe to administer opioids to older adults as long as you start with small doses and frequently assess the patient's response to the medication. Aging does not affect the ability to perceive pain. Sometimes older adults have difficulty interpreting their pain and determining its cause because multiple diseases and vague symptoms affect similar parts of the body. Opioids are safe to use in older adults as long as they are slowly titrated and the nurse frequently monitors the patient. Current evidence shows that patients with dementia most likely experience unrelieved pain because their pain is difficult to assess. The nurse is caring for two patients, both for having a hysterectomy. The first patient is having the hysterectomy after a complicated birth. The second patient has uterine cancer. What will most likely influence the experience of pain for these two patients? A. Neurological factors. B. Competency of the surgeon. C. Meaning of pain. D. Postoperative support personnel. Answer. C. Meaning of pain. The patient's perception of pain is influenced by psychological factors such as anxiety and coping, which in turn influence the patient's experience of pain. Each patient's experience is different. The degree and quality of pain perceived by a patient are related to the meaning of the pain. Neurological factors can interrupt or influence pain perception, but neither of these patients is experiencing alterations in neurological function. The knowledge, attitudes, and beliefs of nurses, physicians, and other healthcare personnel about pain affect pain management but do not necessarily influence a patient's pain perceptions. The nurse anticipates administering an opioid fentanyl patch to which patient? A. A 15-year-old adolescent with a broken femur. B. A 30-year-old adult with cellulitis. C. A 50-year-old patient with prostate cancer. D. An 80-year-old patient with a broken hip. Answer. C. A 50-year-old patient with prostate cancer. A fentanyl patch is an extended relief opioid that provides pain relief for 24 hours a day. This is ideal for patients who have chronic severe pain, such as those who have cancer. The other patients are expected to experience acute pain. Therefore, they will most likely benefit from oral or IV opioids for short-term pain relief. What nursing intervention is most effective in preventing injury to a patient following administration of epidural anesthesia? A. Keeping the reversal agent in a syringe in the patient's bedside table. B. Applying a gauze dressing to the epidural catheter insertion site. C. Labeling the tubing that leads to the epidural catheter. D. Asking the nursing assistive personnel to check on the patient at least once every 2 hours. Answer: C. Labeling the tubing that leads to the epidural catheter to reduce the accidental administration of IV medications into the epidural catheter. The tubing that leads to the epidural catheter needs to be labeled clearly. Medications used to reverse the action of the anesthetic medication need to be kept in a secured location, not in the patient's room in an unsecured location. The epidural insertion site needs to be covered by a clear occlusive dressing to prevent infection and allow the nurse to assess the site. Patients receiving epidural anesthesia need to be monitored every 15 minutes until stabilized and then at least hourly. A 24-year-old Asian woman is in labor and refuses to receive any sort of anesthesia medication. Which alternative treatment is best for this patient? A. Relaxation and guided imagery. B. Transcutaneous electrical nerve stimulation, TENS. C. Herbal supplements with analgesic effects. D. Pudendal Block. Answer: A. Relaxation and guided imagery. Some cultures prefer non-pharmacological measures for pain control. In the case of a patient in labor, relaxation with guided imagery is often an effective supplement for pain management because it provides women with a sense of control over their pain. Relaxation and guided imagery can be used during any phase of health or illness. TENS units are typically used to manage post-surgical and procedural pain. Herbal supplements need to be evaluated for safety during pregnancy. Additionally, some patients consider herbal supplements to be another form of medication, and they are not typically used to control acute pain. A pudendal block is a type of regional anesthesia. Use of it does not respect the patient's wishes for non-pharmacological pain control. Which of the following statements made by the patient indicates to the nurse that teaching on a patient-controlled analgesia (PCA) device has been effective? A. This is the only pain medication I will need to be on. B. I can administer the pain medication as frequently as I need it. C. I feel less anxiety about the possibility of overdosing. D. I will need the nurse to notify me when it is time for another dose. Answer: C. I feel less anxiety about the possibility of overdosing. A PCA is a device that allows the patient to determine the level of pain relief delivered, reducing the risk of oversedation. Its use often eases anxiety because the patient is not reliant on the nurse for pain relief. Other medications, such as oral analgesics, can be given in addition to the PCA machine. The PCA does have a time limit to prevent overdose, but the patient can lengthen the amount of time between doses. One benefit of PCA is that the patient does not need to rely on the nurse to administer pain medication. The patient determines when to take the medication. A nurse is caring for a patient who is experiencing pain following abdominal surgery. What information is important for the nurse to tell the patient when providing patient education about effective pain management? A. To prevent overdose. You need to wait to ask for pain medication until you begin to experience pain. B. You should take your medication after you walk to make sure you do not fall while you are walking. C. We should work together to create a regular schedule of medications that does not allow for breakthrough pain. D. You need to take oral pain medications when you experience severe pain. Answer: C. We should work together to create a regular schedule of medications that does not allow for breakthrough pain. the best way to manage pain is to develop a schedule of medications that are given around the clock to prevent breakthrough pain. The nurse should not wait until pain is experienced because it takes medications 10 to 30 minutes to begin to relieve pain. The nurse administers pain medications before painful activities, such as walking, and administers intravenous medications when a patient is having severe pain. A nurse is caring for a patient who recently had spinal surgery. The nurse knows that patients usually experience acute pain following this type of surgery. The patient refuses to get up and walk and is not moving around in the bed. However, the patient is stoic and denies experiencing pain at this time. What most likely explains this patient's behavior in response to surgery? A. The surgery successfully cured the patient's pain. B. The patient's culture is possibly influencing the patient's experience of pain. C. The patient is experiencing urinary retention because of manipulation of the spine during surgery. This is preventing the patient from experiencing pain. D. The nurse is allowing personal beliefs about pain to influence pain management at this time. Answer: B. The patient's culture is possibly influencing the patient's experience of pain. A patient's culture often influences the patient's expression of pain. In this case, the patient has just had surgery, and the nurse knows that this surgical procedure usually causes patients to experience pain. It is important at this time for the nurse to examine cultural and ethnic factors that are possibly affecting the patient's lack of expression of pain at this time. Even if surgery corrects neurological factors that create chronic pain, surgery causes pain in the acute period. Urinary retention usually creates pain and does not mask surgical pain. The nurse is not allowing personal beliefs to influence pain management because the nurse is attempting to determine the reason why the patient is not verbalizing the experience of pain. A nurse is providing discharge teaching for a patient with a fractured humerus. The patient is going home with Vicodin 5/325. What important patient education does the nurse provide? A. Be sure to eat a meal high in fat before taking the medication to avoid a stomach ulcer. B. Narcotics can be addictive, so do not take them unless you are in severe pain. C. You need to drink plenty of fluids and eat a diet high in fiber. D. As your pain severity lessens, you will begin to give yourself once daily intramuscular injections. Answer: Circa. You need to drink plenty of fluids and eat a diet high in fiber. A common side effect of opioid analgesics is constipation. Therefore, the nurse encourages the patient to drink fluids and eat fiber to prevent constipation. Although medications can be irritating to the stomach, eating a diet high in fat does not prevent gastric ulcers. To best manage pain, the patient needs to take pain medication before painful procedures or activities or before pain becomes severe. As the patient's pain gets better, the strength of the medications will decrease. IM, IV, and topical analgesics are used for more severe and chronic pain. What is the most appropriate way to assess the pain of a patient who is oriented and has recently had surgery? A. Assess the patient's body language. B. Observe cardiac monitor for increased heart rate. C. Ask the patient to rate the level of pain. D. Ask the patient to describe the effect of pain on the ability to cope. Answer: C. Ask the patient to rate the level of pain. Rational pain is a subjective measure. Therefore, the best way to assess a patient's pain is to ask the patient to rate a pain. Nonverbal communication, such as body language, is not as effective in assessing pain, especially when the patient is oriented. Heart rate sometimes increases when a patient is in pain, but this is not a symptom that is specific to pain. Pain sometimes affects a patient's ability to cope, but assessing the effect of pain on coping assesses the patient's ability to cope. It does not assess the patient's pain. A patient arrives at the emergency department experiencing a headache and rates the pain as 7 on a 0 to 10 pain scale. What non-pharmacological intervention does the nurse implement for this patient while awaiting orders for pain medication from the healthcare provider? A. Frequently reassesses the patient's pain scores. B. Reassures the patient that the provider will come to the emergency department soon. C. Softly plays music that the patient finds relaxing. D. Teaches the patient how to do yoga. Answer: C. Softly plays music that the patient finds relaxing. The appropriate non-pharmacological pain management intervention is to quietly play music that the patient finds relaxing. Music diverts a person's attention away from pain and creates relaxation. Reassessing the patient's pain scores is done during evaluation. Building the patient's expectation of the provider's arrival does not address the patient's pain. Although yoga promotes relaxation, nurses teach relaxation techniques only when a patient is not experiencing acute pain. Because the patient is having acute pain, this is not an appropriate time to provide patient teaching. A patient who has had type 2 diabetes for 26 years is beginning to experience peripheral neuropathy in the feet and lower legs, which is causing the patient to have a decreased ability to feel pain in the lower extremities. The nurse is providing education to the patient to prevent injury to the feet. The nurse tells the patient to always wear shoes or slippers when walking. Which of the following statements made by the nurse best explains the rationale for this instruction? A. Wearing shoes blocks pain perception and helps you adapt to pain, which ends up protecting your feet. B. Shoes provide non-pharmacological pain relief to people with diabetes and peripheral neuropathy. C. Since you cannot feel pain as much in your feet, you need to open your neurological gates to allow pain sensations to come through. Wearing shoes helps to open those gates, which protects your feet. D. You've lost the ability to withdraw from pain because of your peripheral neuropathy. If you step on something and are not wearing shoes, you will not feel it. This could possibly cause injury to your foot. Answer: D. You have lost the ability to withdraw from pain because of your peripheral neuropathy. If you step on something and are not wearing shoes, you will not feel it. This could possibly cause injury to your foot. This patient is losing the ability to feel pain owing to peripheral neuropathy. The patient will no longer have protective reflexes to prevent injury to the feet. Wearing shoes prevents the patient from injuring the foot because they protect the feet. Shoes do not block pain perception, nor do they help people adapt to pain. Shoes are not a form of non-pharmacological pain relief. Wearing shoes will not have an effect on opening or closing the pain gates. A nurse is assessing a patient who started to have severe pain 3 days ago. When the nurse asks the patient to describe the patient states, "The pain feels like it is in my stomach. It is a burning pain, and it spreads out in a circle around the spot where it hurts the most." What type of pain does the nurse document that the patient is having at this time? A. Superficial pain. B. Idiopathic pain. C. Chronic pain. D. Visceral pain. Answer: D. Visceral pain. Visceral pain comes from visceral organs, such as those from the gastrointestinal tract. Visceral pain is diffuse and radiates in several directions. Superficial pain has a short duration and is usually a sharp pain. Pain of an unknown cause is called idiopathic pain. Chronic pain lasts longer than 6 months. A patient who had a motor vehicle accident 2 days ago is experiencing pain and is receiving patient-controlled analgesia (PCA). How does the nurse know that the patient is experiencing effective pain management with a PCA? A. The patient is sleeping and is difficult to arouse. B. The patient rates pain at an acceptable level of 3 on a 0 to 10 scale. C. Sufficient medication is left in the PCA syringe. D. The patient presses the control button to deliver pain medication. Answer B. The patient rates pain at an acceptable level of 3 on a 0 to 10 scale. The effectiveness of pain relief measures is determined by the patient. If the patient is satisfied with the amount of pain relief, then pain measures are effective. A patient who is sleeping and is difficult to arouse is possibly over-sedated. The nurse needs to assess this patient further. The amount of medication left in the PCA syringe does not indicate whether pain management is effective. Pressing the button shows that the patient knows how to use the PCA but does not evaluate pain management. The nurse recognizes that which of the following is a modifiable contributor to a patient's perception of pain? A. Age and gender. B. Anxiety and fear. C. Culture. D. Previous pain experience. Answer B. Anxiety and fear. The nurse can take measures to ease the patient's anxiety and fear related to pain. Age, gender, culture, and previous pain experience are all non-modifiable factors that the nurse can help the patient to understand, but the nurse cannot alter them. The nurse is evaluating the effectiveness of guided imagery for pain management as used for a patient who has second and third degree burns and needs extensive dressing changes. Which statement best describes that guided imagery is effectively controlling the patient's pain during dressing changes? A. The patient's need for analgesic medication decreases during the dressing changes. B. The patient rates pain during the dressing changes a 6 on a scale of 0 to 10. C. The patient's facial expressions are stoic during the procedure. D. The patient can tolerate more pain, so dressing changes can be performed more frequently. Answer A. The patient's need for analgesic medication decreases during the dressing changes. The purpose of guided imagery is to allow the patient to alter the perception of pain. Guided imagery works in conjunction with analgesic medications, potentiating their effects. If the patient needs less pain medication during dressing changes, then guided imagery is helping to manage the patient's pain. A rating of 6 on a 0 to 10 scale indicates that the patient is having moderate pain and shows that this patient is not experiencing pain relief at this time. A person who is stoic is not showing feelings, which makes it difficult to know whether or not the patient is experiencing pain. The ability to change dressings more frequently is not a way to evaluate the effectiveness of guided imagery. A nurse is providing medication education to a patient who just started taking ibuprofen, a non-selective non-steroidal anti-inflammatory drug, NSAID. Which statement made by the nurse best indicates how ibuprofen works? A. Ibuprofen helps to remove factors that cause or stimulate pain. B. Ibuprofen reduces anxiety, which will help you better cope with your pain. C. Ibuprofen helps to decrease the production of prostaglandins. D. Ibuprofen binds with opiate receptors to reduce your pain. Answer C. Ibuprofen helps to decrease the production of prostaglandins. NSAIDs like ibuprofen most likely work by decreasing the synthesis of prostaglandins to inhibit cellular responses to inflammation. Ibuprofen does not remove factors that cause pain, nor does it enhance coping with pain. Opioids bind with opiate receptors to modify perceptions of pain. A nurse has brought the patient his scheduled pain medication. The patient asks the nurse to wait to give pain medication until the time for the dressing change, which is 2 hours away. Which response by the nurse is most therapeutic? A. This medication will still be providing you relief at the time of your dressing change. B. Okay, swallow this pain pill, and I will return in a minute to fill your wound. C. Would you like medication to be given for dressing changes on top of your regularly scheduled medication? D. Your medication is scheduled for this time, and I can't adjust the time for you. I'm sorry, but you must take your pill right now. Answer. Circa. Would you like medication to be given for dressing changes on top of your regularly scheduled medication? Stat doses of medication can be given to patients in certain circumstances. As with an extensive dressing change, by asking to hold off on the dose, the patient is indicating that the dressing changes are extremely painful. The regularly scheduled dose might not be as effective for the patient. Oral medications take 30 to 60 minutes to take effect. If the nurse began the dressing change right then, the medication would not have been absorbed yet. The patient has the right to refuse to take a medication. It is the nurse's responsibility to communicate with the provider and with the patient about a pain control plan that works for both. A nurse receives an order from a healthcare provider to administer Vicodin S, which contains 750 mg acetaminophen and 7.5 mg hydrocodone, to a patient who is experiencing intense post-surgical pain. The order is to give 2 tablets every 6 hours by mouth as needed for pain. What is the nurse's best next action? A. Give the Vicodin S to the patient immediately because the patient is experiencing severe pain. B. Ask the healthcare provider to verify the dosage and frequency of the medication. C. Ask the healthcare provider for an order for a non-steroidal anti-inflammatory drug, NSAID. D. Ask the healthcare provider for an order to play music for the patient, in addition to providing the pain medication. Answer. B. Ask the healthcare provider to verify the dosage and frequency of the medication. The maximum 24-hour dosage for acetaminophen is 4 grams. If the patient took 2 tablets of Vicodin S every 6 hours, the patient would take in 6 grams of acetaminophen in 24 hours. This exceeds the safe dosage of acetaminophen, so the best action is to question this order. Giving the medication as ordered would possibly result in the patient taking more acetaminophen than what is considered a safe dose. Acetaminophen overdose can result in liver failure. NSAIDs are used to treat mild to moderate pain. At this moment, the patient is experiencing severe pain. Implementing music therapy is a nursing intervention and is an independent nursing action. Thus, an order to start music therapy is not needed. The nurse knows that which technique is best for assessing pain in a child who is 4 years of age. A. Ask the parents if they think their child is in pain. B. Use the FACES scale. C. Ask the child to rate the level of pain on a 0 to 10 pain scale. D. Check to see what previous nurses have charted. Answer. B. Use the FACES scale. Assessing pain intensity in children requires special techniques. Young children often have difficulty expressing their pain. The FACES scale assesses pain in children who are verbal. Because a 4-year-old is verbal, this is an appropriate scale to use with this child. Parents' statement of pain is not an effective way to assess pain in children because children's statements are the most important. The 0 to 10 pain scale is too difficult for a 4-year-old child to understand. Previous documentation by nurses will tell you what the child's pain has been but will not tell you the child's current pain intensity. Which statement made by a nursing educator best explains why it is important for nurses to determine a patient's medical history and recent drug use? A. Healthcare providers have a responsibility to prevent drug seekers from gaining access to drugs. B. This information is useful in determining what type of pain interventions will most likely be effective in providing pain relief. C. Some recreational drugs have pharmaceutical counterparts that may be more effective in managing pain. D. Getting this information gives the nurse an opportunity to provide patient teaching about drug abstinence. Answer B. This information is useful in determining what type of pain interventions will most likely be effective in providing pain relief. In providing effective pain management, it is important to understand the patient's history, what drugs the patient has already tried, and what interventions work best or have negative actions. It is not the nurse's responsibility to judge or question a patient's pain or label her as a drug seeker. Nurses need to avoid labeling patients as drug seekers because this term is poorly defined and creates bias and prejudice among other healthcare providers. Although certain recreational drugs do have pharmaceutical counterparts, this is not the sole purpose of assessing drug use. The nurse needs more information beyond a patient's medical and medication history to determine whether a patient needs teaching about drug abstinence. A nurse is supervising a student who is caring for a patient with chronic pain. Which statement by the student indicates an understanding of pain management? A. This patient says her pain is a 5, but she is not acting like it. I am not going to give her any pain medication. B. The patient is sleeping, so I pushed her PCA button for her. C. I need to reassess the patient's pain 1 hour after administering oral pain medication. D. It wasn't time for the patient's medication, so when she requested it, I gave her a placebo. Answer. C. I need to reassess the patient's pain 1 hour after administering oral pain medication. Because oral medications usually peak in about an hour. You need to reassess the patient's pain within an hour of administration. Nurses must believe any patient report of pain, even if nonverbal communication is not consistent with pain ratings. The patient is the only person who should push the PCA button. Pushing the PCA when a patient is sleeping is dangerous and may lead to narcotic overdose or respiratory depression. Giving the patient a placebo and telling her it is her medication is unethical. The nurse is assessing how a patient's pain is affecting mobility. Which assessment question is most appropriate? A. Have you considered working with a physical therapist? B. What activities, if any, has your pain prevented you from doing? C. Would you please rate your pain on a scale from 1 to 10 for me? D. What effect does your pain medication typically have on your pain? Answer. B. What activities, if any, has your pain prevented you from doing? Because the nurse is interested in knowing whether the patient's pain is affecting mobility. The priority assessment question is to ask the patient how the pain affects his or her ability to participate in normal activities of daily living. Although a physical therapist is a good resource especially if pain is severely affecting mobility. Considering working with a physical therapist does not describe the effect of pain on the patient's mobility. Assessing quality of pain and effectiveness of pain medication does not help the nurse to understand how it is affecting the patient's mobility. The nurse is teaching a student nurse about pain assessment scales. Which statement by the student indicates correct understanding? A. You cannot use a pain scale to compare the pain of my patient with the pain of your patient. B. When patients say they don't need pain medication, they aren't in pain. C. Pain assessment scales determine the quality of a patient's pain. D. A patient's behavior is more reliable than the patient's report of pain. Answer. Circa. Pain assessment scales determine the quality of a patient's pain. To gain a better understanding of a patient's current pain status and to determine what interventions are needed, the nurse should assess both current and previous pain scores. A patient who rates pain at 4 might find the pain manageable if over the previous 24 hours he had rated his pain at 10. Some patients do not express their pain or do not wish to take medications to relieve the pain. This does not mean they are in pain. The nurse can try non-pharmacological therapies for this patient. The nurse is administering pain medication for several patients. Which patient does the nurse administer medication to first? A. The patient who needs to take a scheduled dose of maintenance pain medication. B. The patient who needs to be pre-medicated before walking. C. The patient with a PCA running who needs to have the syringe replaced. D. The patient who is experiencing 8/10 pain and has a stat order for pain medication. Answer D. The patient who is experiencing 8/10 pain and has a stat order for pain medication. Stat medications need to be given as soon as possible. In addition, this patient is the priority because of the report of severe pain. The other patients need pain medication, but their situations are not as high a priority as that of the patient with the stat medication order. The nurse is assessing a patient for opioid tolerance. Which finding supports the nurse's assessment? A. Increasingly higher doses of opioid are needed to control pain. B. The patient needed a substantial dose of naloxone, Narcan. C. The patient asks for pain medication close to the time it is due around the clock. D. The patient no longer experiences sedation from the usual dose of opioid. Answer A. Increasingly higher doses of opioid are needed to control pain. Opioid tolerance occurs when a patient needs higher doses of an opioid to control pain. Naloxone, Narcan, is an opioid antagonist that is given to reverse the effects of opioid overdose. Taking pain medications regularly around the clock is an effective way to control pain. The pain medication for this patient is most likely effectively managing the patient's pain because the patient is not asking for the medication before it is due. A patient no longer experiencing a side effect of an opioid does not indicate opioid tolerance. A nurse is caring for a patient with rheumatoid arthritis who is now going to be taking 2 acetaminophen Tylenol tablets every 6 hours to control pain. Which part of the patient's social history is the nurse most concerned about? A. Patient drinks 1 to 2 glasses of wine every night. B. Patient smokes 2 packs of cigarettes a day. C. Patient occasionally smokes marijuana. D. Patient takes anti-anxiety medications. Answer A. Patient drinks 1 to 2 glasses of wine every night. The major adverse effect of acetaminophen is hepatotoxicity, because both alcohol and acetaminophen are metabolized by the liver. When taken together, they can cause liver damage. Smoking cigarettes and smoking marijuana are not healthy behaviors, but their effects on health are not affected by acetaminophen. Anti-anxiety medications can be taken with acetaminophen. The nurse is caring for a patient who suddenly experiences chest pain. What is the nurse's first priority? A. Call the rapid response team. B. Ask the patient to rate and describe the pain. C. Raise the head of the bed. D. Administer pain relief medication. Answer B. Ask the patient to rate and describe the pain. The nurse's ability to establish a nursing diagnosis plan and implement care and evaluate the effectiveness of care depends on an accurate and timely assessment. The other responses are all interventions. The nurse cannot know which intervention is appropriate until the nurse completes the assessment, makes a nursing diagnosis, and plans care. The nurse is caring for a patient who recently had surgery to repair a hernia. The patient's pain was 7 out of 10 before receiving pain medication. 1 hour after receiving an oral opioid, the patient ranks his pain at 3 out of 10. The patient asks the nurse why he isn't receiving more pain medication. Which is the nurse's best response? A. This medication can be given only every 4 hours. It is not time for you to have any other pain medication right now. B. I will notify the healthcare provider to come perform an assessment if your pain doesn't improve in 30 minutes. C. If the pain becomes severe, we may need to transfer you to an intensive care unit. D. It can take 2 hours for oral pain medication to work and your pain is going down. Let's try boosting you up in bed and putting an ice pack on the incision to see if that helps. Answer D. It can take 2 hours for oral pain medication to work and your pain is going down. Let's try boosting you up in bed and putting an ice pack on the incision to see if that helps. The patient is responding well to the oral pain medication and it can take up to 2 hours for oral medications to relieve pain. Trying non-pharmacological interventions as an addition to opioid medications is appropriate at this time. If non-pharmacological interventions combined with the oral opioid are ineffective, the nurse needs to notify the healthcare provider and ask for a change in the medication or for additional pain medication. Saying that the patient has to wait 4 hours for additional pain medication is inaccurate because the nurse needs to provide further nursing interventions if pain is not relieved at an acceptable level. For the patient, admission to an intensive care unit is not typically necessary to manage pain following surgery for a hernia. Which of the following is the best way for the nurse to manage pain for a patient with chronic pain from arthritis? A. Administer pain medication before any activity. B. Provide intravascular bolus as needed for breakthrough pain. C. Give medications around the clock. D. Administer pain medication only when non-pharmacological measures have failed. Answer. C. Give medications around the clock. When a patient with arthritis has chronic pain, the best way to manage pain is to take medication regularly throughout the day to maintain constant pain relief. Before activity is nonspecific, and the medication may not have time to work before activity. If the patient waits until having pain to take the medication, pain relief takes longer. Non-pharmacological measures are used in conjunction with medications unless requested otherwise by the patient. A nurse is caring for a patient who fell on the ice and has connective tissue damage in the wrist and hand. What type of pain does the nurse document that the patient has? A. Visceral pain. B. Somatic pain. C. Peripherally generated pain. D. Centrally generated pain. Answer. B. Somatic pain. Somatic pain comes from bone, joint, or muscle. Visceral pain arises from the visceral organs such as the GI tract and pancreas. Peripherally generated pain can be caused by polyneuropathies or mononeuropathies. Centrally generated pain results from injury to the central or peripheral nervous system. The nurse is caring for an infant in the intensive care unit. Which of the following is the most accurate description of factors that will influence the perception and management of pain for this patient? A. Infants cannot tolerate analgesics owing to an underdeveloped metabolism. B. Infants have an increased sensitivity to pain when compared with older children. C. Pain cannot be accurately assessed in infants. D. Infants respond behaviorally and physiologically to painful stimuli. Answer. D. Infants respond behaviorally and physiologically to painful stimuli. Infants cannot verbally express their pain, but they do express pain with behavioral cues and physiological indicators. Infants can tolerate analgesics, but proper dosing and close monitoring are essential. Infants and older children have the same sensitivity to pain. Pain can be assessed even though the neonate cannot verbalize. The nurse can observe behavioral clues. Nurses use behavioral cues and physiological responses to assess pain in infants. A nurse is caring for a patient who recently had an abdominal hysterectomy and states that she is experiencing severe pain. The patient's blood pressure is 110/60ths and her heart rate is 60. Additionally, the patient does not appear to be in any distress. Which response by the nurse is most therapeutic? A. Your vitals do not show that you are having pain. Can you describe your pain? B. You do not look like you are in pain. C. Okay, I will go get you some narcotic pain relievers immediately. D. What would you like to try to alleviate your pain? Answer D. What would you like to try to alleviate your pain? Rationale. The nurse must believe that a patient is in pain whenever the patient reports that he or she is in pain, even if the patient does not appear to be in pain. Whenever the patient reports pain, the nurse needs to collaborate with the patient to determine the best method of pain relief, whether it be medication, meditation, or repositioning. The nurse must be careful to not judge the patient based on vital signs or nonverbal communication and must not assume that the patient is seeking narcotics. The patient is a partner in pain management, so going to get narcotics to treat the pain without consulting with the patient first is not appropriate. Which of the following signs or symptoms in a patient who is opioid naive is of greatest concern to the nurse when assessing the patient 1 hour after administering an opioid? 1. Oxygen saturation of 95%. 2. Difficulty arousing the patient. 3. Respiratory rate of 10 breaths minimum. 4. Pain intensity rating of 5 on a scale of 0 to 10. Answer 2. Difficulty arousing the patient. Rationale. Opioid-naive patients may develop a rare adverse effect of respiratory depression, and sedation always occurs before respiratory depression. A healthcare provider writes the following order for a patient who is opioid naive who returned from the operating room following a total hip replacement: fentanyl patch 100 mcg. Change every 3 days. On the basis of this order, the nurse takes the following action. 1. Calls the healthcare provider and questions the order. 2. Applies the patch the third postoperative day. 3. Applies the patch as soon as the client reports pain. 4. Places the patch as close to the hip dressing as possible. Answer 1. Calls the healthcare provider and questions the order. Rationale. Fentanyl is 100 times more potent than morphine and not recommended for acute postoperative pain. A client is being discharged home on an around-the-clock ATC opioid for chronic back pain. Because of this order, the nurse anticipates an order for which class of medication? 1. Opioid antagonists. 2. Antiemetics. 3. Stool softeners. 4. Muscle relaxants. Answer 3. Stool softeners. Rationale. Constipation is a common opioid-related side effect, and patients do not become tolerant to it. A new medical resident writes an order for oxycodone CR, OxyContin, 10 mg POQ2HPRN. Which part of the order does the nurse question? 1. The drug. 2. The time interval. 3. The dose. 4. The route. Answer 2. The time interval. Rationale. Long-acting or sustained-release opioids are dosed on a scheduled basis, not PRN, to provide a base of continuous opioid analgesia. The nurse reviews a patient's medical administration record (MAR) and finds that the patient has received oxycodone, acetaminophen, Percocet 5/325 2 tablets PO every 3 hours for the past 3 days. What concerns the nurse most? 1. The patient's level of pain. 2. The potential for addiction. 3. The amount of daily acetaminophen. 4. The risk for gastrointestinal bleeding. Answer 3. The amount of daily acetaminophen. Rationale. The Food and Drug Administration (FDA) recommends a maximum daily dose of 4 grams of acetaminophen, and many authorities believe that the maximum daily dose should be lower, 3,000 to 3,200 milligrams per day, in the outpatient setting to reduce the risk of hepatotoxicity. A patient with chronic low back pain who took an opioid around the clock (ATC) for the past year decided to abruptly stop the medication for fear of addiction. He is now experiencing shaking, chills, abdominal cramps, and joint pain. The nurse recognizes that the patient is experiencing symptoms of 1. Opioid toxicity. 2. Opioid tolerance. 3. Opioid addiction. 4. Opioid withdrawal. Answer 4. Opioid withdrawal. Rationale. The common symptoms of opioid withdrawal that are associated with physical dependence may develop when an opioid is withdrawn rapidly. Symptoms include shaking, chills, abdominal cramps, and joint pain. A patient has returned from the operating room, recovering from repair of a fractured elbow, and states that her pain level is 6 on a 0 to 10 pain scale. She received a dose of hydromorphone just 15 minutes ago. Which interventions may be beneficial for this patient at this time? Select all that apply. 1. Transcutaneous electrical nerve stimulation, TENS. 2. Administer naloxone, Narcan, 2 mg intravenously. 3. Provide back massage. 4. Reposition the patient. 5. Withhold any pain medication and tell the patient that she is at risk for addiction. Answer 1. Transcutaneous electrical nerve stimulation, TENS. 3. Provide back massage. 4. Reposition the patient. Rationale. Non-pharmacological therapies may provide comfort for the patient. It is much too early to consider possible addiction. Naloxone is not appropriate at this time because the patient does not show signs of oversedation or respiratory depression. Which of the following instructions is crucial for the nurse to give to both family members and the patient who is about to be started on patient-controlled analgesia (PCA) of morphine? Select all that apply. 1. Only the patient should push the button. 2. Do not use the PCA until the pain is severe. 3. The PCA system can set limits to prevent overdoses from occurring. 4. Notify the nurse when the button is pushed. 5. Do not push the button and go to sleep. Answer 5. Do not push the button and go to sleep. 3. The PCA system can set limits to prevent overdoses from occurring. 1. Only the patient should push the button. Rationale. The safety of PCA is based on the fact that it requires an awake patient to activate the button. The safety is compromised when someone else pushes the button for the patient. A limit on the number of doses per hour or 4-hour intervals may be set. Opioids, morphine, PCA are intended to provide analgesia. Drowsiness is an undesirable potential side effect of opioids, and the PCA should only be used for analgesia. A patient with a 3-day history of a stroke that left her confused and unable to communicate returns from interventional radiology following placement of a gastrostomy tube. The patient has been taking hydrocodone APA P5 325 up to 4 tablets per day before her stroke for arthritic pain. The healthcare provider's order reads as follows: hydrocodone APA P5 325 1 tab per gastrostomy tube, Q4HPRN. Which action by the nurse is most appropriate? 1. No action is required by the nurse because the order is appropriate. 2. Request to have the order changed to around-the-clock ATC for the first 48 hours. 3. Ask for a change of medication to meperidine, Demerol, 50 mg IVP, Q3 hours, PRN. 4. Begin the hydrocodone APAP when the patient shows nonverbal symptoms of pain. Answer 2. Request to have the order changed to around-the-clock ATC for the first 48 hours. Rationale. The patient can be expected to have acute pain related to the G-tube insertion. In addition, she has a history of chronic pain. Her pain should be treated with ATC medication to match the timing of her pain. Why would a primary health care provider prescribe acetylcysteine to a patient who is on pharmacological pain management therapy? 1. Overdose of aspirin. 2. Overdose of fentanyl. 3. Overdose of morphine. 4. Overdose of acetaminophen. Answer 4. Overdose of acetaminophen. Rationale. Dangerous hepatotoxic overdoses of acetaminophen are treated with acetylcysteine. Anti-ulcer drugs may be prescribed to treat gastric bleeding caused by overdose of aspirin. Overdoses of fentanyl and morphine may be treated with naloxone. The registered nurse is teaching a patient about the use of cold therapy in acute pain management. Which of the patient's statements indicates a need for further teaching? 1. I will apply ice 2 to 5 times a day. 2. I will apply ice with a lightweight cover with firm pressure to my skin. 3. I will apply ice within a 6-inch circular area near where I have pain. 4. I will place ice between my thumb and index finger if I have shoulder pain. Answer 4. I will place ice between my thumb and index finger if I have shoulder pain. Rationale. Cold is effective for tooth or mouth pain, not shoulder pain. When the ice is placed on the web of the hand between the thumb and index finger, this is an acupressure point that influences nerve pathways to the face and head. The remaining statements indicate understanding. Ice can be applied 2 to 5 times a day with firm pressure to the skin, covered with a lightweight cloth. Ice should also be applied within a 6-inch circular area near the site of pain. A patient rates his pain as a 6 on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain. The patient's wife says that he can't be in that much pain since he has been sleeping for 30 minutes. Which is the most accurate resource for assessing the pain? 1. Patient's self-report. 2. Behaviors. 3. Surrogate wife report. 4. Vital sign changes. Answer 1. Patient's self-report. Rationale. Patient's self-report of pain. Sleep is not an indicator of pain intensity. Unless a patient is stimulated, it is difficult to distinguish sleep from sedation, which may occur as a side effect of the opioid. Patients in pain sometimes sleep from exhaustion. When teaching a patient about transcutaneous electrical nerve stimulation, TENS, which information do you include? 1. TENS works by causing distraction. 2. TENS therapy does not require a health care provider's order. 3. TENS requires an electrical source for use. 4. TENS electrodes are applied near or directly on the site of pain. Answer 4. TENS electrodes are applied near or directly on the site of pain. Rationale. TENS units act on both the central and peripheral nervous systems. The peripheral effect occurs through activation of the neuroreceptors that are near the source of pain. Therefore, the electrodes should be placed near the site. Answer 4. TENS electrodes are applied near or directly on the site of pain. Rationale. TENS units act on both the central and peripheral nervous systems. The peripheral effect occurs through activation of the neuroreceptors that are near the source of pain. Therefore, the electrodes should be placed near the site. A primary health care provider prescribes medication for a patient in respiratory distress. Shortly after the patient complains of severe pain, which medication did the patient likely receive? 1. Naloxone. 2. Capsaicin. 3. Lidoderm patch. 4. Acetaminophen. Answer 1. Naloxone. Rationale. Naloxone is prescribed for respiratory depression as a result of opioid overdose. Administering too much too quickly may cause severe pain and other serious complications. Capsaicin is effective for relief from minor aches and muscle and joint pain, not respiratory distress. A Lidoderm patch is effective for relieving cutaneous neuropathic pain, not respiratory distress. Acetaminophen is effective for treating musculoskeletal pain, not respiratory distress. Which statement is true regarding non-pharmacological pain interventions? 1. Non-pharmacological interventions should only be used alone. 2. Non-pharmacological interventions are useful for patients who cannot tolerate pain medications. 3. Non-pharmacological interventions have a clear set of guidelines regarding intensity and duration. 4. Non-pharmacological interventions should be used in place of pharmacological therapies for acute pain. Answer 2. Non-pharmacological interventions are useful for patients who cannot tolerate pain medications. A postoperative patient currently is asleep. Therefore, the nurse knows that 1. The sedative administered may have helped him sleep, but it is still necessary to assess pain. 2. The intravenous IV pain medication given in recovery is relieving his pain effectively. 3. Pain assessment is not necessary. 4. The patient can be switched to the same amount of medication by the oral route. Answer 1. The sedative administered may have helped him sleep, but it is still necessary to assess pain. Rationale. A pain assessment is still needed because sleep in a postoperative patient cannot be used as an assessment of a patient's pain level. Sleep may result from sedating effects of medication, but analgesia may not be present. It is important to wake and assess the patient to ensure that the pain is controlled and the patient is not overly sedated from the medication, a sign of impending respiratory depression. A physician put a postoperative patient on a patient-controlled opioid analgesic pump to be used around the clock for a week. Which assessment should the nurse make at regular intervals? 1. Liver enzymes. 2. Blood pressure. 3. Respiratory rate. 4. Body temperature. Answer 3. Respiratory rate. Rationale. While there is little risk for overdose with patient-controlled analgesic pumps, respiratory depression is a side effect associated with opioids. So, while the patient is on opioid pain management, the nurse should regularly check respiratory rate. A nurse may check liver enzymes in a patient who is taking acetaminophen, not opioids, because acetaminophen can adversely affect the liver, whereas blood pressure and body temperature may be checked regularly. It is unlikely that the nurse is doing this to monitor for side effects of opioid pain management. Which class of pain management drugs may interfere with bowel or bladder function? 1. Anticonvulsants. 2. Opioid analgesics. 3. Non-opioid analgesics. 4. Non-steroidal anti-inflammatory drugs. Answer 2. Opioid analgesics. Rationale. Opioid analgesics are effective when used for pain management, but a common side effect is disruption of bowel or bladder function. Anticonvulsants are more commonly associated with side effects like dizziness, fatigue, and confusion than with disrupted bowel and bladder function. Non-opioid analgesics and non-steroidal anti-inflammatory drugs more commonly result in gastric bleeding, hypertension, and nausea than in disruption of bowel and bladder function. Which statement is true regarding opioids for pain management? 1. Morphine is available only for oral administration. 2. Hydrocodone is only available intravenously. 3. Oxycodone is available for both oral and intravenous administration. 4. Hydromorphone is available for both oral and intravenous administration. Answer 4. Hydromorphone is available for both oral and intravenous administration. Rationale: hydromorphone is available for both oral and intravenous administration. The remaining statements are false. Morphine is also available both orally and intravenously. Hydrocodone and oxycodone are available only for oral administration. Which pain management drug is considered the best tolerated and safest analgesic? 1. Fentanyl. 2. Tramadol. 3. Acetylcysteine. 4. Acetaminophen. Answer: 4. Acetaminophen. Rationale: acetaminophen is considered the best tolerated and safest analgesic used in pain management. Fentanyl and tramadol are opioids, which have the potential for significant side effects and often result in patients building a tolerance to them. Acetylcysteine is not an analgesic, rather, it is used to treat acetaminophen overdose. Which statement about transcutaneous electrical nerve stimulation (TENS) is incorrect? 1. TENS is helpful in reducing pain perception. 2. TENS is effective for chronic and post-surgical pain control. 3. A TENS unit consists of a battery-powered transmitter, lead wires, and electrodes. 4. TENS requires a healthcare provider's order that identifies the sites for electrode placement. Answer: 2. TENS is effective for chronic and post-surgical pain control. Rationale: transcutaneous electrical nerve stimulation (TENS) is effective for acute, emergent, and post-surgical and procedural pain control but not for chronic pain. The remaining statements are correct. TENS is helpful in reducing pain perception. A TENS unit consists of a battery-powered transmitter, lead wires, and electrodes. TENS requires a healthcare provider's order that identifies the sites for electrode placement. Which analgesic drug depresses the central nervous system? 1. Aspirin. 2. Fentanyl. 3. Naproxen. 4. Ibuprofen. Answer: 2. Fentanyl. A 65-year-old patient is experiencing mild musculoskeletal pain. Which drug is the primary health care provider most likely to prescribe? 1. Aspirin. 2. Naproxen. 3. Ibuprofen. 4. Acetaminophen. Answer: 4. Acetaminophen. Rationale: a physician may first recommend acetaminophen to this patient because the pain is mild, and acetaminophen is relatively safe and widely available over the counter for musculoskeletal pain. The physician may prescribe aspirin, naproxen, or ibuprofen, but these may be second-choice drugs because they are non-steroidal anti-inflammatory drugs which carry a risk for bleeding, especially in older adults, and may not be necessary if the pain is mild. The nurse administers 250 mg of acetaminophen along with 5 mg of hydrocodone to a patient in pain. Why is acetaminophen part of this protocol? 1. To reduce the risk of hepatotoxicity. 2. To prevent the risk of oversedation. 3. To prevent the occurrence of respiratory depression. 4. To decrease the dose of opioid required for pain control. Answer: 4. To decrease the dose of opioid required for pain control. Rationale: administration of acetaminophen will reduce the dose of opioid drug required to achieve maximum pain relief. Acetaminophen overdose leads to hepatotoxicity. It does not prevent it. Oversedation and respiratory depression can be adverse side effects of opioid administration, but acetaminophen treats only pain. A nurse administers epidural anesthesia to a patient in the terminal stages of cancer for pain relief. Which nursing intervention is then necessary? 1. Administering supplemental doses of opioid. 2. Assessing vitals once every hour after administering the first dose. 3. Administering anticoagulant medications with the epidural. 4. Notifying the healthcare provider if the patient develops pain at the epidural insertion site. Answer 4. Notifying the healthcare provider if the patient develops pain at the epidural insertion site. Rationale: the nurse should notify the healthcare provider if the patient develops pain at the epidural insertion site, because it may indicate development of an epidural hematoma. Administering supplemental opioids could lead to dangerous additive central nervous system adverse effects. The nurse should monitor vital signs and respiratory rate once every 15 minutes after the administration of epidural anesthesia to ensure stable vitals. Once every hour is not enough. Anticoagulants and antiplatelet drugs should not be administered to the patient because they may increase the risk of hematoma formation. Which type of pain management therapy is preferred for relieving chronic cancer pain? 1. Local anesthesia. 2. Topical analgesic. 3. Epidural analgesia. 4. Paraneural local anesthetic infusion. Answer 3. Epidural analgesia. Rationale: epidural analgesia is preferred for relieving chronic cancer pain. Local anesthesia is used to numb specific areas in acute pain. Topical analgesics are used to treat neuropathic and musculoskeletal pain. Paraneural local anesthetic infusion is used to relieve pain during surgical procedures. Which pain management method is considered a non-pharmacological complementary and alternative intervention? 1. Distraction. 2. Biofeedback. 3. Guided imagery. 4. Therapeutic touch. Answer 4. Therapeutic touch. Rationale: therapeutic touch is a non-pharmacological complementary and alternate pain management intervention. Distraction, biofeedback, and guided imagery, music are non-pharmacological but considered cognitive behavioral, not alternative and complementary, interventions. Which topical analgesic is effective for relieving post-herpetic neuralgia in adults? 1. Capsaicin. 2. Elomax, LMX. 3. Lidoderm patch. 4. Eutectic mixture of local anesthetics, EMLA. Answer 3. Lidoderm patch. Rationale: the Lidoderm patch is effective for treating post-herpetic neuralgia, a cutaneous neuropathic pain. Capsaicin is more appropriate for relieving minor aches and pains of the muscles and joints. Elomax, LMX, and a eutectic mixture of local anesthetics, EMLA, are more often used to treat children. A patient took more than the prescribed amount of acetaminophen and is experiencing hepatotoxicity. Which drug might the nurse anticipate the healthcare provider to use to treat this patient? 1. Naloxone. 2. Tramadol. 3. Oxycodone. 4. Acetylcysteine. Answer 4. Acetylcysteine. Rationale: overdose of acetaminophen may lead to hepatotoxicity, which is treated with acetylcysteine. Naloxone is used to reverse the adverse effects of opioids, not acetaminophen. Tramadol and oxycodone are used to manage pain, not to treat acetaminophen overdose. The nurse is assessing a patient who has sustained severe injuries in a motor vehicle accident. The patient is in severe pain and is diaphoretic. On assessment, the patient's heart rate is increased, pupils are dilated, and blood pressure is decreased. Which finding is caused by the stimulation of the parasympathetic nervous system? 1. Diaphoresis. 2. Dilation of pupils. 3. Increased heart rate. 4. Decrease in blood pressure. Answer 4. Decrease in blood pressure. Rationale: superficial pain or mild to moderate pain stimulates the sympathetic nervous system. The parasympathetic nervous system is stimulated by continuous, deep or severe pain involving visceral organs. Stimulation of the parasympathetic nervous system has an inhibitory effect on the body systems and causes a decrease in blood pressure. The sympathetic nervous system prepares the body for a fight or flight response. Diaphoresis, dilation of pupils, and increased heart rate are caused by the stimulation of the sympathetic system. The nurse has conducted an informative session on discouraging pseudo-addiction to a group of people in a community. Which group of patients should be the main target for the nurse's teachings? 1. Patients with a history of taking over-the-counter medicines. 2. Patients with a history of drinking coffee for more than 5 years. 3. Patients who say that heroin increases concentration. 4. Patients who repeatedly seek multiple medical opinions for chronic pain relief. Answer 4. Patients who repeatedly seek multiple medical opinions for chronic pain relief. Rationale: when a patient with chronic pain seeks pain medication from multiple primary health care providers, the patient is called a drug seeker but not an illicit drug abuser. This kind of addiction is called pseudo-addiction. Such drug seekers should be referred to pain specialists. Pseudo-addiction is not related to a history of taking over-the-counter medicines or the history of drinking coffee for more than 5 years. The patients who say that heroin increases concentration do not have pseudo-addiction. During a preoperative assessment, a patient reports history of a heart attack and use of anticoagulant medications. If epidural anesthesia is administered to the patient for the surgery, for which possible complication should the nurse look? 1. Synergistic effects. 2. Hematoma. 3. Allergic reaction. 4. Respiratory depression. Answer 2. Hematoma. Rationale: because anticoagulants reduce the action of the blood's platelets. Hematoma is a possible complication when epidural anesthesia is administered to a patient on anticoagulants. Anticoagulants and anesthesia have different actions, so a synergistic effect is not a concern. Anticoagulants do not predispose a patient to an allergic reaction to epidural anesthesia. Respiratory depression is an adverse effect of opioids, but anticoagulants do not make it more likely. The physician tells the nurse to administer a second drug to a patient already on oxycodone. Which drug would be safe for this patient? 1. Fentanyl. 2. Morphine. 3. Codeine. 4. Acetaminophen. Answer 4. Acetaminophen. Rationale: acetaminophen is safe to use in combination with opioids like oxycodone for pain relief. A healthcare provider may do so to lower the opioid dose. Fentanyl, morphine, and codeine are also opioids, so combining them with another opioid would have potentially dangerous synergistic effects. Which type of pain management is cold application? 1. Relaxation. 2. Distraction. 3. Cutaneous stimulation. 4. Acupressure. Answer 3. Cutaneous stimulation. Rationale: cold application stimulates the skin, which helps reduce pain perception, perhaps by releasing or activating large, fast-transmitting beta sensory nerve fibers. Relaxation techniques include meditation, yoga, guided imagery, and progressive relaxation exercises. Distraction works by diverting the patient's attention to something other than pain, thus reducing awareness of it. Acupressure involves the application of pressure, not cold. While treating a patient, the primary health care provider encourages the patient to watch funny videos. This is an example of which pain management technique. 1. Relaxation. 2. Distraction. 3. Acupressure. 4. Music therapy. Answer 2. Distraction. Rationale: patients who are bored or in isolation may think more frequently about their pain, thus perceiving it more acutely. Watching videos may direct the patient's attention to something other than pain, reducing awareness of it. This is an example of using distraction to manage pain. Relaxation techniques include meditation, yoga, guided imagery, and progressive relaxation exercises. Acupressure is applying pressure to specific points on the body in order to influence nerve pathways to decrease pain perception. Like distraction, Music therapy works by taking the patient's attention away from the pain, but this is done with music, not videos. A patient with rheumatoid arthritis reports acute joint pain in the hand. Which intervention is inappropriate for providing pain relief? 1. Encouraging the patient to listen to music or watch television. 2. Collaborating with an occupational therapist to provide assistive devices for grooming. 3. Administering ordered analgesics around the clock for 24 to 48 hours. 4. Applying cool compresses to the patient's joints with the prescriber's approval. Answer 2. Collaborating with an occupational therapist to provide assistive devices for grooming. Rationale: the nurse may collaborate with an occupational therapist to provide assistive devices to the patient for grooming. But this is not done to relieve pain. Rather, this is an intervention to help the patient dress and prepare for the day if the joint pain is making this difficult. The remaining interventions are appropriate for pain relief. Music and television can help relieve pain by taking the patient's attention away from it. Analgesic administration is a pharmacological therapy method to provide pain relief. Cool compresses may also help soothe the pain caused by rheumatoid arthritis. The nursing instructor asks the student nurse to differentiate between A and C peripheral nerve fibers. Which statement made by the student nurse indicates effective learning? 1. The A fibers are myelinated and the C fibers are unmyelinated. 2. The A fibers are smaller in diameter and the C fibers are larger in diameter. 3. The A fibers transmit signals slowly and the C fibers transmit signals rapidly. 4. The A fibers cause diffuse sensation and the C fibers cause localized sensations. Answer 1. The A fibers are myelinated and the C fibers are unmyelinated. Rationale: the A fibers are myelinated, whereas the B fibers are unmyelinated. The A fibers are larger in diameter, whereas the B fibers are smaller in diameter. Because the fibers are larger in diameter, they transmit signals to the central nervous system, CNS, more rapidly than the smaller C fibers. The sensations caused by the stimulation of the A fibers are localized, whereas the sensations caused by the stimulation of the B fibers are diffuse. A student nurse is reading about the mode of action of non-steroidal anti-inflammatory drugs, NSAIDs. The NSAID drug decreases the level of a chemical that is known to increase pain sensitivity. With which chemical does the NSAID react? 1. Renin. 2. Serotonin. 3. Prostaglandin. 4. Diclofenac sodium. Answer 3. Prostaglandin. Rationale: prostaglandins are generated from the breakdown of phospholipids of the cell membrane and are known to increase pain sensitivity. NSAIDs act by decreasing the levels of such compounds in the blood. Renin is involved in balancing water and electrolytes in the body. Neurotransmitters such as serotonin inhibit the transmission of pain. Diclofenac sodium is a painkiller that reduces pain sensitivity. What is the immediate intervention if a patient on oxycodone 10 mg per milliliter infusion therapy experiences respiratory depression? 1. Administering acetylcysteine. 2. Reducing the dose of oxycodone to 5 mg per milliliter. 3. Decreasing the rate of infusion. 4. Administering 0.4 mg of naloxone. Answer 4. Administering 0.4 mg of naloxone. Rationale: respiratory depression is a serious side effect of opioid administration. Naloxone counters the effects of opioids. So this drug would be used to treat respiratory depression resulting from morphine administration. Acetylcysteine is used to counter acetaminophen, not opioid overdose. Oxycodone is also an opioid that can result in further respiratory depression. The patient should be immediately treated with naloxone as airway and breathing are top priorities of care over pain or less severe side effects. Which drug is unsafe for the central nervous system as a supplement to epidural anesthesia? 1. Aspirin. 2. Naproxen. 3. Ibuprofen. 4. Oxycodone. Answer 4. Oxycodone. Rationale: because opioid analgesics like oxycodone depress the central nervous system. They are not safe in combination with epidural anesthesia because of possible additive central nervous system adverse effects. Aspirin, naproxen, and ibuprofen are non-steroidal anti-inflammatory drugs, NSAIDs, which do not affect the central nervous system. A patient is in the first post-operative day following a nephrectomy. The patient is receiving morphine through a patient-controlled analgesia device for management of pain. The patient complains of pain in the shoulders. The nurse understands that it is a referred pain. What explanation should the nurse give to the patient regarding the referred pain? 1. It is a pain that occurs sporadically over time. 2. It is a moderate pain that occurs for more than 6 months constantly. 3. It is a pain that is sensed at a site away from its actual origin or pathology. 4. It is neuropathic pain that is caused generally after cancer or tumor. Answer 3. It is a pain that is sensed at a site away from its actual origin or pathology. Rationale: a pain that is sensed at a site away from its actual origin or pathology is known as referred pain. A pain that occurs sporadically over time is known as chronic episodic pain. A moderate pain that occurs constantly for more than 6 months is known as chronic or persistent noncancerous pain. A cancer pain is neuropathic pain that is caused generally after cancer or a tumor. Which adjuvant drug relieves pain caused by inflammation and bone metastasis? 1. Corticosteroids. 2. Antidepressants. 3. Opioid analgesics. 4. Non-steroidal anti-inflammatory drugs. Answer 1. Corticosteroids. Rationale: corticosteroids relieve pain caused by inflammation and bone metastasis. Antidepressants relieve neuropathic pain. Opioid analgesics and non-steroidal anti-inflammatory drugs are used in acute and chronic pain management and are not adjuvant drugs. The nurse is administering ibuprofen Advil to an older patient. Which of the following assessment data causes the nurse to hold the medication? Select all that apply. A. Past medical history of gastric ulcer. B. Patient states last bowel movement was 4 days ago. C. Stated allergy to aspirin. D. Patient states has 2 tense intermittent joint pain. E. Patient experienced respiratory depression after administration of an opioid medication. Answer 1. CA. Past medical history of gastric ulcer. C. Stated allergy to aspirin. NSAIDs can cause bleeding, especially in the gastrointestinal GI tract. Therefore, NSAIDs are most likely contraindicated in this patient. Patients with an allergy to aspirin are sometimes also allergic to other NSAIDs. The nurse needs to verify that the healthcare provider is aware of the history of GI bleeding and of allergy to aspirin before administering ibuprofen. NSAIDs do not interfere with bowel function and are used for the treatment of mild to moderate acute intermittent pain. NSAIDs also do not suppress the central nervous system. When using ice massage for pain relief, which of the following is correct? Select all that apply. 1. Applying ice using firm pressure over skin. 2. Apply ice for 5 minutes or until numbness occurs. 3. Apply ice no more than 3 times a day. 4. Limit application of ice no longer than 10 minutes. 5. Use slow, circular, steady massage. Answer 1, 2, and 5. 1. Applying ice using firm pressure over skin. 2. Apply ice for 5 minutes or until numbness occurs. 5. Use slow, circular, steady massage. Rationale. Apply the ice with firm pressure over the skin, then use a slow, steady circular massage. Apply ice for 5 minutes or until the patient feels numbness. It is acceptable to apply ice 2 to 5 times a day. While caring for a patient with cancer pain, the nurse knows that a multimodal analgesia plan includes select all that apply. 1. Using analgesics such as non-steroidal anti-inflammatory drugs (Nsaids) along with opioids. 2. Stopping acetaminophen when the pain becomes very severe. 3. Avoiding polypharmacy by limiting use of medication to one agent at a time. 4. Avoiding total sedation, regardless of the severity of the pain. 5. The use of adjuvants co-analgesics such as gabapentin, Neurontin to manage neuropathic type pain. Answer. 1. Using analgesics such as non-steroidal anti-inflammatory drugs (Nsaids) along with opioids. 5. The use of adjuvants co-analgesics such as gabapentin, Neurontin to manage neuropathic type pain. Rationale. Multimodal analgesia involves the use of a combination of drugs with at least 2 different mechanisms of action so pain control can be optimized. The use of acetaminophen, NSAIDs, gabapentin, an opioid represents a multimodal analgesic plan because each agent relies on a different mechanism of action to reduce pain, with the benefit of reducing the amount of opioid that is needed to control pain. This differs from polypharmacy because the combination of drugs is intentional and based on understanding of the action of each product on the pain pathway. A patient is in the first post-operative day following a nephrectomy. The patient is receiving morphine through a patient-controlled analgesia (PCA) device for management of pain. The nurse decides to use the ABCDE approach while assessing and managing pain for this patient. What are the correct components of the ABCDE approach? Select all that apply. 1. Ask regularly about the pain. 2. Assess the pain once a week. 3. Believe the patient about the pain. 4. Choose pain control options appropriate to the patient. 5. Deny the use of painkillers and encourage the patient to bear the pain naturally. Answer. 1, 3, and 4. 1. Ask regularly about the pain. 3. Believe the patient about the pain. 4. Choose pain control options appropriate to the patient. Rationale. The ABCDE approach helps in accurately assessing pain and its management. A stands for ask regularly about the pain. B stands for believe the patient and family in the report of pain. C stands for choose pain control options appropriate for the patient. D stands for deliver interventions in an orderly and coordinated fashion. E stands for empower patients and their families. A patient has had arthritic pain for 8 years. Which questions should the nurse ask to assess the patient's pain? Select all that apply. 1. Which factors relieve your pain? 2. How would you describe the pain? 3. Are you having any trouble passing stools? 4. Are you allergic to any food item or medication? 5. On a scale of 0 to 10, how high would you rate the pain? Answer. 1. Which factors relieve your pain? 2. How would you describe the pain? 5. On a scale of 0 to 10, how high would you rate the pain? Rationale. To assess the pain completely and accurately, the nurse needs to assess its onset, palliative factors, quality, radiation, severity, and time factors related to the pain. Asking about palliative factors helps to determine the factors that influence the pain. A description of the pain helps to understand the nature and location of the pain. Asking a patient to rate the pain on a pain scale helps to assess the intensity of the pain. Asking questions regarding elimination and allergies does not help in pain assessment. The nurse is teaching a group of nursing students about concepts of pain in infants. Which information should the nurse include in the teaching? Select all that apply. 1. Infants cannot express pain. 2. Absorption of drugs is faster than expected. 3. Infants are less sensitive to pain than adults are. 4. Preterm neonates have greater sensitivity to pain than older children do. 5. Assessment of pain involves behavioral cues and physiological indicators. Answer 2. Absorption of drugs is faster than expected. 4. Preterm neonates have greater sensitivity to pain than older children do. 5. Assessment of pain involves behavioral cues and physiological indicators. Rationale absorption of drugs in infants is faster than expected. The drugs that are excreted by the kidneys should be administered in a lower dosage. Preterm neonates have greater sensitivity than term neonates or older children. Using behavioral cues such as facial expression and physiological indicators such as changes in vital signs provide proper assessment of pain. Infants cannot verbalize pain but respond with behavioral changes. Term neonates have the same sensitivity to pain as older children. A patient is in the first post-operative day following a nephrectomy. The patient is receiving morphine through a patient-controlled analgesia (PCA) device for management of pain. The patient is apprehensive about being given opioid drugs and is afraid of becoming addicted to the drug. The patient is also afraid of chronic side effects. What explanation should the nurse give the patient? Select all that apply. 1. Opioids can be used safely in cases of moderate to severe pain. 2. Opioids can be given only after surgery or for post-surgical pain. 3. Slow titration prevents potentially dangerous opioid-induced side effects. 4. The drug is administered carefully because its action cannot be reversed. 5. In case of any adverse effects, opioid antagonist drugs can be given to reverse the effects. Answer 1. Opioids can be used safely in cases of moderate to severe pain. 3. Slow titration prevents potentially dangerous opioid-induced side effects. 5. In case of any adverse effects, opioid antagonist drugs can be given to reverse the effects. Rationale: there are many misconceptions about the use of opioid drugs. Opioids can be safely given to people for management of moderate to severe pain. Opioids are given in slow titration to prevent the appearance or development of any side effects. In rare cases, there may be respiratory depression as an adverse effect of opioid drugs. In such cases, an opioid antagonist drug can be administered to the patient to reverse the effects of opioids. It is not mandatory to give opioids only after surgery. They can be administered to relieve pain of any origin. The action of opioids can be reversed with the proper antagonist drug. The nurse is learning about the effects of pain on the sympathetic system. What are the manifestations of sympathetic stimulation in response to the pain? Select all that apply. 1. Increased heart rate. 2. Rapid, irregular breathing. 3. Increased glucose level. 4. Decreased blood pressure. 5. Decreased gastrointestinal motility. Answer 1. Increased heart rate. 3. Increased glucose level. 5. Decreased gastrointestinal motility. Rationale: the stimulation of the sympathetic branch of the autonomous nervous system causes an increased heart rate, an increased glucose level, and decreased gastrointestinal motility. Stimulation of the parasympathetic branch results in rapid, irregular breathing and decreased blood pressure. Which non-pharmacological techniques pose a risk of injury to the patient if the patient has a history of diabetic neuropathy? Select all that apply. 1. Yoga. 2. Massage. 3. Hot bath. 4. Cold application. 5. Relaxation exercises. Answer: 3 hot bath and 4 cold application. Rationale: a patient who has diabetic neuropathy may not be able to adequately monitor temperature in areas affected by nerve damage. So application of any heat or cold may place this patient at a higher risk for injury. If done safely and properly, yoga, massage, and relaxation exercises should not place a patient with diabetic neuropathy at a higher risk for injury than any other patient. A patient in pain mentions a history of allergy to aspirin. Which drugs might a health care team avoid for this patient? Select all that apply. 1 fentanyl, 2 morphine, 3 naproxen, 4 ibuprofen, 5 oxycodone. Answer: 3 naproxen and 4 ibuprofen. Rationale: some patients who are allergic to aspirin may have a higher risk of allergy to other non-steroidal anti-inflammatory drugs, NSAIDs. Naproxen and ibuprofen are NSAIDs, so the healthcare team may avoid them to prevent the risk of allergic reaction. Fentanyl, morphine, and oxycodone are opioids. And an allergy to aspirin is not indicative of an allergy to opioids, so the healthcare team may use them for this patient. The nurse is assessing the touch, pain, and temperature sensation of a patient who is diagnosed with diabetic neuropathy. Arrange in ascending order the parts of the central nervous system through which pain sensation is carried. 1. Cerebrum, 2. Thalamus, 3. Spinal cord, 4. Medulla pons, midbrain. Answer: 3. Spinal cord, 4. Medulla pons, midbrain, 2. Thalamus, 1. Cerebrum. The nurse is teaching pain management to a group of caregivers. Which information should be included? Select all that apply. 1. Chronic pain is often psychological. 2. Only hospitalized patients experience severe pain. 3. Psychogenic pain is not real. 4. Regular administration of analgesics will not lead to addiction. 5. Patients with minor illnesses may also experience severe pain. Answer: 4. Regular administration of analgesics will not lead to addiction. 5. Patients with minor illnesses may also experience severe pain. Rationale: misconceptions about pain often lead to poor nursing care. Therefore, it is important to know these misconceptions in order to promote appropriate pain management in patients. Regular administration of analgesics does not lead to addiction. Therefore, analgesics should be administered whenever the need arises. Although a patient may suffer from minor illness, he or she may experience severe pain that should not be ignored. A common misconception is that chronic pain is often psychological. However, chronic pain may have a pathological origin. Another misconception is that only hospitalized patients experience pain. Patients who are not hospitalized may also experience pain that needs to be addressed. Another misconception is that psychogenic pain is not real. The nurse is teaching a group of caregivers about the concept of pain in older adults. What should the nurse include in the teachings? Select all that apply. 1. Older patients underreport pain. 2. Sleeping indicates pain relief. 3. Opioids are safe to use in older patients. 4. Older adults tend to perceive more pain. 5. Older adults with cognitive impairment do not experience less pain. Answer: 1. Older patients underreport pain. 3. Opioids are safe to use in older patients. 5. Older adults with cognitive impairment do not experience less pain. Rationale: older patients underreport pain with the fear of losing their independence and do not want to alarm loved ones. Opioids are safe to use with proper monitoring of the patient to note any side effects. There is no evidence that cognitively impaired older adults experience less pain compared to individuals with intact cognitive function. Sleeping does not indicate pain relief. It indicates exhaustion, and in fact, pain may prevent the patient from having a good sleep. Age does not dull the sensitivity to pain. Older adults perceive pain as much as young adults. The registered nurse and a nursing student are discussing opioid pain management therapy and naloxone, Narcan. Which of the nursing student's statements indicate a need for further teaching? Select all that apply. 1 inch. The infusion rate of an intravenous push of naloxone should be 0.5 milliliters for 1 minute. 2 inches. 0.4 milligrams of naloxone should be diluted with 15 milliliters saline. 3 inches. Opioid-naive patients should be closely monitored. For sedation, 4 inches. Administering naloxone faster than the recommended rate may cause severe pain. 5 inches. If an adult patient experiences respiratory depression, naloxone should be administered. Answer: 1 inch. The infusion rate of an intravenous push of naloxone should be 0.5 milliliters for 1 minute. 2 inches. 0.4 milligrams of naloxone should be diluted with 15 milliliters saline. Rationale: naloxone, Narcan, is used to reverse the effects of opioids, especially in cases of overdose. While administering naloxone, the intravenous IV push should be at a rate of 0.5 milliliters every 2 minutes, not for 1 minute, until the respiratory rate is greater than 8 breaths per minute. Generally, 0.4 milligrams of naloxone is diluted with 9 milliliters, not 15 milliliters, saline. The remaining statements are correct. Opioid-naive patients should be closely monitored for sedation, which occurs before respiratory depression. If naloxone is administered too quickly, the patient may experience severe pain and other serious complications. If an adult patient who is on pain management therapy with opioid analgesics experiences respiratory depression, naloxone should be administered. The registered nurse is teaching a nursing student about applying transcutaneous electrical nerve stimulation (TENS) to a patient. Which of the nursing student's statements indicate a need for further teaching? Select all that apply. 1 inch. I should set the frequency to no more than 50 Hz. 2 inches. I should use TENS on patients who have chronic cancer pain. 3 inches. I should place TENS electrodes directly over or near the site of pain. 4 inches. I should apply hair or skin preparations before placing TENS electrodes. 5 inches. I should remove TENS electrodes if the patient feels a buzzing or tingling sensation. Answer: 2 inches. I should use TENS on patients who have chronic cancer pain. 4 inches. I should apply hair or skin preparations before placing TENS electrodes. 5 inches. I should remove TENS electrodes if the patient feels a buzzing or tingling sensation. Rationale: transcutaneous electrical nerve stimulation (TENS) is effective in treating acute, emergent, and post-surgical and procedural pain control, but not chronic conditions like cancer pain. The nurse should not apply any hair or skin preparations before attaching the TENS electrodes. Buzzing or tingling sensations are normal and do not require the nurse to remove electrodes. The other statements indicate understanding. The range of frequency of TENS is 10 Hz to 50 Hz. The TENS electrodes should be placed directly over near the site of pain. A primary health care provider prescribes 10 milligrams of codeine every 4 hours to a patient who has chronic pain from cancer. However, after taking a second dose of the prescribed drug, the nurse notices that the patient is very drowsy and nauseous. Which dose alteration may provide effective pain relief while improving the drowsiness and nausea? 1. 5 milligrams codeine every 4 hours. 2. 10 milligrams codeine every 8 hours. 3. 20 milligrams codeine every 8 hours. 4. 5 milligrams codeine every 12 hours. Answer: 1. 5 milligrams codeine every 4 hours. Rationale: because codeine is short-acting, relief is likely only attainable with administration every 4 hours. If 5 milligrams is not enough, or the side effects remain, the patient may require a different opioid. Even at every 8 hours, 10 mg and 20 mg doses are too much for the patient to tolerate without adverse side effects. A 5 mg dose every 12 hours is probably too long of an interval for this patient to obtain relief from the pain. The nurse is caring for a patient on pain management therapy. Which types of therapy cause a release of endorphins that can block the transmission of painful stimuli? Select all that apply. 1. Massage. 2. Opioid analgesics. 3. Cold application. 4. Non-steroidal anti-inflammatory drugs, Nsaids. 5. Transcutaneous electrical nerve stimulation, TENS. Answer. 1. Massage. 3. Cold application. 5. Transcutaneous electrical nerve stimulation, TENS. Rationale. Cutaneous stimulation releases endorphins, which block the transmission of painful stimuli. Massage, cold application, or transcutaneous electrical nerve stimulation, TENS, all stimulate the skin, which may be helpful in reducing pain perception via endorphin release. Opioid analgesics reduce pain by binding with opiate receptors to modify pain perception, not by releasing endorphins. Non-steroidal anti-inflammatory drugs, Nsaids, reduce pain by inhibiting prostaglandin synthesis, which inhibits the body's cellular response to inflammation. The nurse is assessing a patient with acute pain. Which statements are true about acute pain? Select all that apply. 1. Acute pain is not protective. 2. Acute pain has an identifiable cause. 3. Acute pain has limited tissue damage. 4. Acute pain results in prolonged hospitalization. 5. Patients with acute pain seek numerous healthcare providers. Answer. 2. Acute pain has an identifiable cause. 3. Acute pain has limited tissue damage. 4. Acute pain results in prolonged hospitalization. Rationale. Acute pain has an identifiable cause, limited tissue damage, and an emotional response. Acute pain results in prolonged hospitalization as it seriously threatens a patient's recovery, so the health team members treat it aggressively. Acute pain is protective, unlike chronic pain, which is not protective. A patient with chronic pain may seek numerous healthcare providers because of its unknown cause. Which drugs may provide relief from bone pain? Select all that apply. 1. Calcitonin. 2. Gabapentin. 3. Nortriptyline. 4. Bisphosphonates. 5. Infusional lidocaine. Answer. 1. Calcitonin. 4. Bisphosphonates. Rationale. Calcitonin and biphosphates are effective in relieving bone pain. Gabapentin, nortriptyline, and infusional lidocaine are typically used to treat neuropathic pain, not bone pain. A patient who underwent abdominal surgery experiences constipation and severe cramping. Which non-pharmacological nursing interventions may provide relief to this patient? Select all that apply. 1. Helping the patient walk. 2. Increasing the patient's fluid intake. 3. Providing stool softeners to the patient. 4. Planning sleep therapies for the patient. 5. Providing an elevated toilet seat to the Answer. 1. Helping the patient walk. 2. Increasing the patient's fluid intake. Helping the patient ambulate can provide relief from constipation because the movement of abdominal muscles decreases abdominal distension, promoting bowel movement. Increasing the patient's fluid intake promotes bowel movement, which will reduce abdominal cramping. Administering stool softeners is a pharmacological intervention. Sleep therapy can help a patient experiencing fatigue, and raising a toilet seat could help a patient with limited mobility due to pain. But these interventions will not relieve constipation and cramping. The human body has a mechanism to reduce pain perception by inhibitory neurotransmitters. What are the inhibitory neurotransmitters of pain in the brain? Select all that apply. 1. Serotonin. 2. Histamine. 3. Substance P. 4. Norepinephrine. 5. Gamma-aminobutyric acid. Answer: 1 serotonin, 4 norepinephrine, 5 gamma-aminobutyric acid. Rationale: during the process of pain modulation, endogenous opioids, serotonin, norepinephrine, and gamma-aminobutyric acid (GABA) are some of the inhibitory neurotransmitters released to inhibit the pain impulse. This happens in the fourth and final phase of the nociceptive process. Histamine and substance P have no role in pain modulation. Histamine is released by mast cells and plays a major role in the inflammatory process. Substance P transmits pain impulses from the periphery to higher brain centers. Which statements about opioid analgesics for pain management are correct? Select all that apply. 1. Opioid analgesics act on higher centers of the brain. 2. Use of opioid analgesics will increase libido in male patients. 3. Opioid analgesics are prescribed for relieving mild forms of pain. 4. The short-acting forms of opioids provide pain relief for approximately 4 hours. 5. Prolonged use of opioid analgesics will increase patient tolerance to depression of the central nervous system. Answer: 1. Opioid analgesics act on higher centers of the brain. 4. The short-acting forms of opioids provide pain relief for approximately 4 hours. Rationale: opioid analgesics act on higher centers of the brain and spinal cord by binding with opiate receptors. The short-acting forms of opioid analgesics provide pain relief for approximately 4 hours. Opioid analgesics will decrease the testosterone levels in male patients, decreasing, not increasing, libido. Opioid analgesics are prescribed to relieve moderate to severe levels of pain. Other drugs are more appropriate for mild pain. Prolonged use of opioid analgesics will increase patient tolerance to most opioid side effects except central nervous system depression. The nurse works in a post-surgical ward. Which statements by the nurse indicate common misconceptions about pain? Select all that apply. 1. Psychogenic pain is not real. 2. Chronic pain is not psychological. 3. Patients who cannot speak can feel pain. 4. Administering analgesics regularly leads to drug addiction. 5. Patients who abuse substances overreact to discomfort. Answer: 1. Psychogenic pain is not real. 4. Administering analgesics regularly leads to drug addiction. 5. Patients who abuse substances overreact to discomfort. Rationale: psychogenic pain is real and requires intervention. Regular administration of analgesics does not lead to drug addiction. However, some analgesics such as morphine should not be overused. The patients who abuse substances do not overreact to discomfort. Their discomfort may be real. Chronic pain is not psychological. It may be real and can have an impact on daily activities. Patients who do not speak can still feel pain and need intervention. The nurse is caring for a patient who is on opioid therapy. For which findings is the nurse carefully observing the patient? Select all that apply. 1. Decreased pulse rate. 2. Increased respiratory rate. 3. Decreased blood pressure. 4. Pupil dilatation. 5. Peripheral edema. Answer: 1. Decreased pulse rate. 3. Decreased blood pressure. 5. Peripheral edema. Rationale: potential adverse effects of opioids include bradycardia, decreased pulse rate, hypotension, decreased blood pressure, and peripheral edema due to the accumulation of fluids. Decreased, not increased, respiratory rate may occur with opioid administration. Pupil constriction may occur with the use of opioids, but pupil dilatation is an effective opioid withdrawal. A group of nursing students is learning about nociceptive and neuropathic pain. What are examples of neuropathic pain? Select all that apply. 1. Aching muscles. 2. Diabetic neuropathy. 3. Trigeminal neuralgia. 4. Nerve root compression. 5. Throbbing pain at knee joint. Answer: 2. Diabetic neuropathy. 3. Trigeminal neuralgia. 4. Nerve root compression. Rationale. Neuropathic pain arises when there is abnormal processing of sensory input by the peripheral or central nervous system. Pain felt along the distribution of many peripheral nerves, as in diabetic neuropathy, is a neuropathic pain. Pain felt partly along the distribution of a damaged nerve, such as in nerve root compression, is also an example of neuropathic pain. Pain associated with trigeminal neuralgia is also a neuropathic pain. Aching muscles and a throbbing pain at the knee joint are examples of nociceptive pain.